see, we have a presentation by ISfTeH and also Deidre, and we are looking forward to hear and listen and see the slides. On my screen, I can see that everything seems to be perfectly in order technically. So I wish you a very fruitful webinar on teledentistry. Maybe I can invite now ISfTeH to make a presentation. Thank you.
Sure. Thank you very much, Dr. Frank. Thank you for the honor of being presented by you and also for having your presence with us. I know you have many responsibilities and you are supporting this activity with us. Thank you very much. I also would like to thank Dr. Adolfo and Dr. Patricia, coordinating the working group, the student working group, for inviting us, me and Daisy. She's here also with me. We are very pleased also to have this opportunity to share some experience we have been developing here in Brazil and also with the working group. And I would like to thank also Dr. Marcia Rendeiro, which coordinates our teledentistry working group and is also connected here with us. Thank you very much, Marcia. And thank all the colleagues that are here. I hope we can exchange ideas. We will be brief in the presentation so that we can exchange some ideas after that. I also like especially to thank Dr. Regina Ungerer. She's from the International Society, but also from our Brazilian Association of Telemedicine and Telehealth. And some of the slides that I will present, I borrowed by her, so thank you very much. And also thank the group from Maranhão, Federal University of Maranhão. Some of them are here with us, but some of them are in another place now celebrating 10 years of telehealth in Maranhão. So it's a coincidence in the schedule. Well, thank you very much. What we will speak a little bit is our Brazilian experience. We have a Brazilian special interest group of teledentistry. It's linked to the University Network of Telemedicine. The acronym is HUTE because of the Portuguese name. And we'll show you some of that. First of all, I would like to tell you that we are here in Brazil, South America, and also that we are a large country in South America. We are also the largest Portuguese-speaking country. Our country is divided into 26 states and also the federal district, exactly in the center of the country, where we have the capital. 5 macro regions. Now here you can see also South America. And we are very diverse in the country, in the different regions. We have, for instance, in the north region, we have the Amazon River and the Amazon forest. And from south to north, we are very diverse in the country. We love football. And we have, since our federal constitution, we established a national health system. This national health system is a universal access system, and we are a population of 200 million inhabitants. So it's a very big challenge to have this national health system. And we are always looking for new tools and new strategies so we can actually offer a democratic access for all citizens. And telehealth is one of them, one of these strategies that we have been developing. So we have actually three integrated initiatives of e-health in Brazil that deal at the same time with healthcare, education, and research. We have the Brazilian telehealth program, which is more focused on teleassistance and a kind of teleeducation, but through teleassistance. We have the Open University of SUS that gives courses, specializing courses to thousands of health professionals. Actually, we achieved this year 1 million enrollments in the Open University of SUS. They are all health professionals from the health system that goes through these courses and give more resolution and better healthcare for the population. And we also have the Telemedicine University Hospital Network, the HUCI, where the special interest group is located. So these three initiatives, the two first of them are from the Ministry of Health, and HUCI is from the Science and Technology Ministry, also with partner with Ministry of Education and Ministry of Health. The Brazilian national program, the telemedicine and telehealth program, its objective, the main objective is to create, to build capacity of health professionals, especially for working with primary health care. We promote the integration of among the health units and try to increase resolution, offering teleconsultings, telediagnosis, teleeducation, and also what we call the formative second opinion. The formative second opinion, they are like a combo of a question and an answer, which is developed through bibliography consulting and with evidence, scientific evidence that are shared with all professionals through the website. We started in 9 states, but nowadays the program is already in most of the states. All the blue states here, they already have the program implemented. So 25 states, 2,000 cities from a total of more than 5,000 cities. So almost half of the cities in the country already have the Brazilian program of telehealth. Approximately 30,000 health professionals receive the program and work with the program. We have already offered more than 3 million telediagnoses, more than 3 million teleeducation activities, and more than 500,000, not teleconsultations, actually teleconsultings, because we have a professional present with the patient. We cannot offer teleconsultations directly to the patient at a distance. Our Brazilian Council of Medicine doesn't allow that. The legislation doesn't allow it. So we have actually teleconsultings. And we have very good results. This year, the program is celebrating 10 years since its creation. It has expanded also, it started with primary health care, but now it already expanded to secondary and high complexity levels of healthcare. It includes many services, and it has a legislation, a normative legislation. It's also, which is published at the International Journal of the International Society. We have an article, a manuscript, which have been published about it last year, and it's adopted as a national policy already. It's very consolidated. The program is very wide, and in 2011 it has been received an award of recognition by the Pan American Health Organization as a successful model. and we were very proud of that. This is, you can see the website where we have many activities, experiences that are related, and many instruments that support the professionals in their daily practice. The other initiative, the Telemedicine University Network, HUCI, where is our special interest groups, we have already 124 telehealth units connected all over the country. They are in teaching hospitals and also in medicine schools. And we have 57 special interest groups working in different matters, in different specialties. One of them is teledentistry. These are some examples of the different special interest groups at work. We have, each group has a monthly webinar with different teams, different topics that are approached, and we have a program, a year program, which we follow all over the year. The teledentistry group of the special interest group from HUCI is coordinated by the Faculty of Dentistry at the University of São Paulo. Here you can see the University of São Paulo and the Faculty of Dentistry. And we also share this coordination with our Brazilian Association of Dental Education, ABENO, and with BIDEMI, which is a center of from PAHO, from the Pan American Health Organization, is a center of information, health information. This is our Center of Teledentistry and Telehealth at the Faculty of Dentistry. We have a classroom of electronic learning. We have a studio for developing our video classes. We have a video conference room and also a classroom for thesis, master and PhD thesis defenses at a distance. So we can have professors from different parts of the world taking part at remoting. We have many research projects. One of them is with the Virtual Man project. We have been developing learning objects, and we have a website for the center, which have been developed by Daisy, that is sharing this conference with me. And the other initiative, the Open University of SUS, is a very well succeeded also initiative. This year we achieved 1 million enrollments in the different courses that are offered. And Daisy, now almost right now, will talk to you about one of the courses that we are being developed in a very successful and spread way by UNASUS. And this course, she will talk to you. We intend to offer it also for the International Society in English and Spanish languages. Some of the persons participating here, Tatiana and Daisy and others, have taken part in the development of this course. So she will talk to you. This is the site store. This is a very important initiative of the UNASUS through the Federal University of Maranhão. Professor Ana Emília coordinates this initiative. She's in another activity today at Maranhão, but she's the coordinator of this initiative, the site store, where we have these many e-books and apps and courses that are certificated. Even in the Apple Store or the Google Play, you can have access to this all this content, and one of them will be now presented by Daisy. This is the layout of the courses, the e-books that are already available And you can access by the mobile or at the Moodle platform. And right now, I would like to thank you for this opportunity. I'll be here for questions and right away pass to Daisy, and she will talk about these courses, which is also the project of PhD thesis of her. Thank you very much. Patricia, if you can talk pass to Daisy. Thank you.
Good morning.
Thank you, Professor Stella.
Fred, Paty. Good morning, good afternoon. I'd like to thank Dr. Adolfo Sparenberg and Dr. Patricia Dias and Frank Lidens for this opportunity. It is a pleasure for us to present our work. My name is Daisy. I am a dentist. Today I'm going to present an overview of my doctorate research. It's a part of my research project, and I'm working with development of a distance course of dentistry for special needs patients. The coordinators of this project are the teachers, Ana Emília Oliveira and Ana Estela Haddad. The Unified Health System, SUS, is the Brazilian set of public health services that offers global access to healthcare and disease treatments for all citizens. Brazil has invested substantially in expanding access to healthcare for all citizens, a goal that's implicit in the Brazilian Constitution and the principles guiding the national health systems. The SUS comprises public and private healthcare institutions and providers. In this slide, you can see some numbers of SUS. The system performs, for example, 2,008 billion annual outpatient procedures, 1.4 billion medical appointments, 11.5 million hospitalizations, 90 million cancer procedures, and 30.1 million chemotherapy procedures. Within the Brazilian public health care system, and given the country's immense territory, training health professionals to care for patients is a complex and expensive process. One of the solutions found was the creation of the National University of the Unified Health System, UNASUS, which provides distance learning courses for professionals holding a college degree. Since its beginning in 2010, it has provided training and continuing education for health professionals living in remote locations. Currently, it has more than 1 million enrollments in those courses. Well, in addition, chronic diseases are the major health problem and contribute for about 70% of the causes of death in Brazil. The main ones are diabetes, hypertension, cancer, cardiovascular disease, chronic respiratory disease, and chronic kidney disease. Over 18% of the global population is living with moderate to severe functional problems related to disability, and a large proportion of these persons will require special care dentistry at some point in their lifetime. It is estimated that 9% of people requiring special care dentistry should be able to access treatment in a local primary care setting. Provision of such primary care is only possible through the education and training of dentists. The literature suggests that it's vital for the dental team to develop the necessary skills and gain experience treating people with special needs in order to ensure access to provision of oral health care. Education and special care dentistry. Thus, in 2016, we developed a 45-hour massive open course to improve the education of dentists and students for the care of special patients. The 45-hour self-instructional course was divided into 3 sections, covering contents on the dental care of patients with diabetes, chronic kidney disease, and hypertension. 2 teams of health professionals, information technology professionals, designers, pedagogues, and others were formed. The team led by Professor ISfTeH Haddad participates professors and graduate students of the Department of Pediatric Dentistry, of the Special Patient Care Center, GEAP and CAP, and the Telehealth and Teledentistry Center. The team led by Professor Ana Emília Oliveira of the Federal University of Maranhão and UNASUS is the most numerous. Numerous professionals are part of the team and only a few names are listed here. In March 2016, a pedagogical training was carried out to elaborate the educational contents. In summary, the project took the following steps. First, a pedagogical training was carried out. Second, after didactic planning was done of how the course would be. Third, after this, the content was elaborated, underwent a content validation and a pedagogical validation. After this course, went to production, and after 2 months since the beginning of the project, the course was launched on December 6, 2016. It's important to note that although it is a non-tutor course, there is a team that manages the course offer, clarifying doubts and correcting administrative problems. The course uses Moodle as a learning management system. The first offer occurred from December 6, 2016 until June 5, 2017, and we had a total of 7,000 subscribers. The second offer was open on July 5 and is still open to subscribers. Participants will have until January 13, 2018. Now I am going to present some results from the first course, since we do not yet have all the data of the second offer. From the first course offer, we had a total of more than 7,000 enrolled. We had enrolled in 197 Brazilian cities, which represent 35 of the total of the 5,570 cities, Brazilian municipalities. When evaluating the distribution of enrolls by age group, we see that 6% is concentrated in the age group ranging from 26 to 40 years. The vast majority, just over 70%, are female. When looking at enrollment by region, 16% are from Northwest Brazil, Next comes the salt with 13%, and a percentage of 6% you cannot identify from which region they are. Enrollments per occupation, we have 83% of dentists, but we have nurse auxiliary, nurses, doctors, and the others. But if you don't have interest in doing the course, we have the e-books with the same content of the course. The e-books cover evidence-based content on diabetes, chronic kidney disease, and hypertension. All 3 e-books are available in the site store virtual library. Just access, install the application on your smartphone or tablet, and download the e-books. Specialized and renowned professionals coming from Brazilian universities are responsible for elaborating the contents. In addition, all material is standardized based on extensive research on educational application, iconography, and instructional design. The SITE Group, a Brazilian group for research in health, innovation, technology, and education, developed a tool for e-learning, mobile learning, the SITE Store. SITE Store is a virtual library that contains e-books in several thematic areas such as home care, public health management, scientific methodology, health surveillance, distance learning, pharmaceutical care, and Portuguese, health of the elderly, dentistry, nephrology, healthcare networks, and primary care. The material is available in Portuguese, which guarantees access to thousands of speakers of this language in the different countries in which it is used. It's dentistry. SITE Store is available for Android and iOS operating systems with downloads at Google Store and Apple Store and in a web version. Both the SITE Store and its e-books are completely free. Another advantage is that internet access is only required to download the store and its e-books, and then the user can exploit all the content, which is dynamic, interactive, and rich in animation in offline mode. This feature mainly benefits users who live in places where internet services are limited. Recently, the store has reached the number of 200 e-books. And now we have in Spanish and English too. We have 6 e-books now in English and in Spanish. Sorry, the e-books is hypertension, diabetes, and chronic kidney disease. This is a print screen and the link in Google Play. Here is a book in Google Play. And the link in Apple Store. It's a print screen of a book of chronic kidney disease and a book diabetes print screen. And these links for all material, all e-books. And thank you for us. It's all.
Guys, do you have one question? You can see in the chat?
Yeah. The target audience for ebooks is for dentists now.
Even dentists, but also undergraduate students. We have many students here at the University of São Paulo that have done the course. They used to like it also. I take this opportunity to thank Dr. Adolfo and thank Dr. Rosangela, who is listened to us also. Dr. Rosangela Godin is the Vice President of the Brazilian Association of Telemedicine and Telehealth. Thank you for your presence.
Rodrigo is for dental professionals and students too.
I would like to, Anistela Nova, again, I'd like to take this opportunity to thank some of the team that worked in this project that is also here at the conference with us. So I'd like to thank Adria Malheiros, to thank also Gilson Abelo, Elza, Josie, Catherine, they all worked, Mariana, in the project. And they are here with us.
Rosangela is asking do you plan to offer an English version of any of these books? Now we have 3 books: chronic kidney disease, diabetes, and hypertension. But we are planning for
Daisy, can you hear me?
Sim, yeah.
We can't hear you. Can you repeat, please?
Hello, Patrícia.
Hello, now is okay.
Rodrigo Marinho, você viu a pergunta do Rodrigo?
more questions? The link to the recorded session will be in format soon. We will send you via email. And the next session is planned to February.
Alessandra Campos é a professora da...
We would like to thank you everyone for the participation. And Professor Frank, would you like to say some words?
Yes, I'm just back on the mic. I want to say thank you very much to all the participants in the name of the International Society. This is an example to follow. As I said in the opening, we want to do much more of this. We want to keep those presentations, and I know it's recorded, so with also the sound in the back. On our website, we on the TELEDENTISTRY working group page, we do have the possibility to store this as we do have for the other working groups, so that within a year, and hopefully we can produce 5 or 6 of these webinars with even more than 2 presentations each, so that after a year we will have good materials to show to our members, but also as it is open access to other people around the world. We communicate further through the ISfTeH newsletters and member announcements. I think it's also important that we can get more members to follow. The more people we will be, the more diversity health in the various disciplines will progress. So thank you again to all of you for participating. tell the others what they missed if they were not able to join. And we wish you, in the name of the International Society, a Merry, Merry Christmas and a wonderful upcoming New Year 2018. All the best over there in Brazil. Thank you.
Thank you, Frank.
Frank, thank you very much for all your support for the International Society, for us to have this opportunity of working together, of sharing our experience. It's a very, we are very honored with that. And I hope, yes, we can have 1 year from now, lots of others experiences also reported and available at the International Society website. We have Rodrigo here. Rodrigo, be our guest to join the Teledentistry Working Group. Send us an email and we will we'll work on that, okay? Thank you, Dr. Adolfo, Dr. Patricia, for inviting us. And I hope next time you present at the working group of Teledentistry, and we can also invite you to share your experience there.
Thank you, Professor Anastela and Daisy, for the excellent explanation.
Thank you, Patricia, Frank, and Dr. Adolfo for this opportunity.